So my name's Sophie Goggins. I'm the curator of biomedical science at National Museum Scotland in Edinburgh. That means I'm responsible for the entire medical and veterinary collection at the museum. What a lot of people are surprised about is that while I'm responsible for all of history from the beginning of time to present day for medicine, my specialism is contemporary biomedicine, as my title reflects. So I'm particularly interested in contemporary science going on here in Scotland. So for everyone who's not come to visit us, I'll let you off, I won't do a show of hands. But National Museum Scotland is based in Edinburgh on Chambers Street. We're the largest visitor attraction outside of London in the United Kingdom. So we get about 3.5 million visitors a year. And you might be surprised to find, or not to predict this particular audience, but a lot of people are surprised to find that tropical parasitology is a big research area in Scotland. So a couple years ago, Scotland's not particularly tropical, but lots of tropical researchers. So one of the best bits of my job is that I get to go around to different universities and research centers and industry and ask, what's the coolest thing that you're working on? And it's one of the most enlightening parts of my job and the most fun, if I'm being honest, but don't tell my boss. And a couple of years ago, 4 to be exact, almost 5, I got in touch with the Wellcome Centre for Anti-Infectives Research in Dundee and was hearing about all of the work they're doing towards developing new treatments and drugs for tropical diseases. And what happened is they put us in touch with 2 other centres, so the Wellcome Centre for Integrative Parasitology in Glasgow, and then Edinburgh Infectious Diseases in, as the name suggests, Edinburgh. And those 3 organisations came together and part-funded an exhibition that opened on the 6th of December at National Museum Scotland. So it's about parasitic tropical disease. So as well as being in collaboration with these 3 partners, it was also in collaboration with a secondary school, one in Glasgow and one in Edinburgh. So not only did we decide to do an exhibition about a topic most of the Scottish public are not familiar with, parasitic disease, we also decided to highlight the hardest area to reach for museums, so that's secondary schoolers. So what happens for us and most other national museums is that until you're about 10, your parents bring you to the museum on a rainy day, we're free, we're warm, we have lots to see. But then after you turn about 10, we genuinely don't see those visitors again until they have their own children. Secondary schoolers, if anyone has any in their lives, are not particularly interested in learning. So especially that kind of forced learning. So one of the most interesting things that we found when we spoke to the Castlebrae kids who we were working with is we had them all stand up. Promise I'm not going to make you do it, or rub your tummies again. Just awake, make sure everything's awake. Don't want to bring anyone's attention back to their stomachs just before lunch. But we did have them all stand up and go, if this side of the room is absolutely yes, and this side of the room is absolutely no, are you going to study science at a higher level? And they all shuffled over to absolutely yes. And then we said, do you like science? Absolutely no. So they'd all been hit over the head so much about careers. They all knew science was something they should study at a higher level so they can get into university in that voice. But none of them were enjoying science in school. And so we both had this school group who we worked with, but also teachers. And one of the things we learned is that the curriculum is limiting in some ways, and there's not a lot of hands-on activities that go on in the classroom to do with science anymore. And also that kind of inspiration and joy and learning and curiosity are things that aren't necessarily reflected in the curriculum presently. So that's really what we sought to do, was do an exhibition that was not necessarily education first, but engaging first. So we first had to decide between the 3 centres which kind of topic we would go for, and we decided to meet the parasites. So I apologize in advance, only 4 are neglected tropical diseases. So we have schistosomiasis, leishmaniasis, sleeping sickness, and guinea worm. We, at first, were going to do an exhibition entirely on neglected tropical diseases, but our first focus groups found that no one knew how to pronounce any of these, let alone had heard of them. So unfortunately, or fortunately, malaria is included as the gateway parasite that most people have heard of. So in the first section of the exhibition, I just thought I'd talk through the 4 sections. All you do is meet these parasites. So for most people, the idea of what is a parasite, a vector, and disease, that's the only thing we're looking for them to get out of in the first section. So they interact with these kind of light boards, but also find out the symptoms that each of the parasites causes. And then in the second section, we talk about the discovery of these diseases. So really quick through the history. It's the smallest section, so a but the rest from then on is all contemporary material. So what you're looking at here is a section where the visitor gets to interact with some of the scientists working in Scotland and across the globe on diseases. So that's Francisco Mutapi, Susan Wiley, Sarah Rees, Annette MacLeod, and Donald Hopkins. So they hear about their work in their own words, and then there's also books for them to interact with about the kind of case studies. Later on in that section is a game that's a malaria game, so it's about immunity and about the immune system going out to get you, so you act as the parasite. One of the things that we found from both our secondary school research and our visitor research is because most of these diseases won't necessarily affect the vast majority of our visitors, that they need to be emotionally invested in a different way. And playing games where they play themselves as the parasite is not a new idea, but it is one where people get an emotional investment in what's going to happen. The third section in the lab is one of the most hands-on ones. A lot of the teachers we spoke to actually told us that, and through universities themselves, that most undergraduates who first start at university now have never actually used a microscope. They've never looked down one, they don't know how to use one. So that was quite a surprise for us as an organization, but it meant that we definitely wanted to include microscopes in the exhibition space. So this space talks about drug development and also the study of parasites in the lab and vectors in the lab. So you get to look down the microscope at mosquitoes, schistosomiasis, leishmaniasis parasites. And it's been quite lovely to go around and I take off my pass first, but spy, seeing everyone look down and be able to focus the microscopes. And this section also includes a game about how do we design a drug. So how chemists, pharmacologists, and biologists work together to design drugs. And we're not meant to have favorites, but the last section is my favorite. So Battle for Survival is the last section and brings together all of the information that you've learned in the previous sections, but also uses some objects to illustrate the importance of public health and working with local communities. So one of the things that's commented on, or people don't pick up on, both are lovely, is that it was an intentional choice to not include any images of patients or treatments in the exhibition. So I think someone earlier was talking about poverty porn, that we had seen other exhibitions in the past that touched on some of these topics that had included that kind of imagery, and we decided to entirely exclude it from the exhibition. But we did work with charities and local groups as well to collect objects like this mosquito net. Some of you are probably very familiar with this. So it's mosquito nets which have been sewn together to make a fishing net. So it was given out in Malawi, and it was particular a charity, and the country itself couldn't decide on logo placement. So there was no public health campaign sent out, no imagery, nothing with the mosquito nets. They were just handed out. What happened in that particular area was the nets were then sold to fishermen, sewn together, fished the local lake. So not only did the increase of malaria not go down, but schistosomiasis increased because of the overfishing of the local lake. So whilst a horrible story, it's a fantastic object for us as a museum, because without objects, we can't tell stories. And for us, that's a great one of being able to reinforce a big topic for us about the importance of working with a local community and public health programs. But back to that emotional investment I talked about. So throughout all of the exhibition, what you'll be doing is building your own parasite. So as you go through, you can find out at the first section, how do you want to get around? Do you want to hop, swim, or fly? How do you want to get inside the body? How do you want to evade the immune system? And what's the biggest threat to your survival? And then at the end of the exhibition, you find out what parasite you are most like. So if anyone here would like to find out that it's all available online, you can go have a play and find out what parasite you are. I'd like to all hear. I'm personally am guinea worm. Don't know what that says about me as a person, but but I wanted to talk really quickly about the importance of objects. So I thought one of the nice things to say about working with museums, if any of you have in the past or are thinking about it in the future, is that there are some amazing stories in all kinds of science, but particularly medicine, that have what I call a big gray box problem. Of the most amazing things that are going on in science sometimes are found inside a big or little gray box that is a really unengaging object for the visitor. It doesn't mean we won't collect it, it just means it makes it really hard to display. But by working with the scientists at the 3 centres in Scotland, we talked a lot about objects and what kind of objects appeal to the public. So if you're looking necessarily to interact with the museum, my 2 things would be to think of what objects you might be able to use to illustrate your story, Most museums don't include any flat paper material, for instance, so we don't and a lot of us don't have digital outputs as well. So any kind of physical objects, and the second is timescales. So this exhibition took 5 years from the first meeting that we had about it to it opening. So it's quite a long lead time for a lot of museums. So I'm booked until 2025, but afterwards, give me an ask. Yeah, and evaluations, we've touched on a lot. So one of the nice things is we're doing a lot of evaluation for the project. So it started on the 6th of December, runs till April 20th, and I'd be happy to share the evaluation of the exhibition. That's both from our general visitors and our school's programming after it opens. And for anyone who's interested, all of the games that are in the exhibition have a life after and a legacy after with all 3 of the universities in their programming. But if anyone else is interested in using any of the games, please do get in touch. Thanks a lot.